this is Shanghai. This is where I've lived for the last few years. And it's where I had the opportunity to work at IDEO for about 4 years as a business designer. I worked on a lot of healthcare projects. And because of these projects, I traveled all across China to all sorts of different types of hospitals and to different type of patients' homes. And this is part of the kind of human-centered design process. And what I learned from all of these research interviews is that China's healthcare system is in a very serious and critical state. But because of these problems, there are actually a lot of opportunities here. And though it is inspired by China, I hope that a lot of these opportunities can help inspire you here or from whichever country that you come from. So China is a place where everything seems the same or homogeneous. But actually, there are many, many extremes here. And the most obvious one is the population. There are 1.4 billion people. And because of the one-child policy that started in the 70s, this is a very rapidly growing aging population. By 2050, a quarter of the population will be over 65. Right now, in China, they spend about 350 euros per capita for healthcare. This is compared to about 3,700 euros in Belgium, here. But as this population ages, China will not be able to do things the same way. This is going to be a huge challenge on the healthcare system and the government. And besides the population, this is also a very large country. So there's this province, Qinghai. It's in the middle of the country, and it is made out of 700,000 square kilometers. There are only 70 hospitals in this province. So imagine the distance that one has to go just to see a doctor. Compare this to France with almost the same square kilometer-ish and 2,700 hospitals. The environment itself in China is in a very, very bad state. And this is what Beijing looks like on some days. You can't even see 10 meters in front of you. I was there in Beijing a few weekends ago, and my friend, he couldn't even go out of the building without wearing a gas mask. And when 1.4 billion people get sick, there's a lot of people. For example, high blood pressure. 140 million people with this problem. This is half of the population of the United States. So when you put all these problems together, it's a very large challenge. It's a very challenging healthcare system. So at IDEO Shanghai, one of the main missions is to tackle systemic issues like this through design thinking. So the way we do this is to look across and within the healthcare ecosystem to unearth the user needs and the motivations that drive a solution's final usage. So in order to do this, we look across a large array of stakeholders, not just patients, but also doctors, distributors, hospital heads, and even the pharmaceutical companies themselves. And when you put all these stakeholders together, it results in a very complex system. So this is one of the tools we use at IDEO, which is called the ecosystem magnets, where we can map out a system and understand what is influencing a final solution's usage. So even though we can map it out, this is actually a very complicated system, and it's in a very complex and dire state right now. So I want to show you how the system is already in a very bad situation. So we want to look at these issues in 3 categories: the resources, the relationships, and the results. So let's start with resources. There is a very inadequate and unfair distribution of healthcare within the country. So you see these people sleeping on the ground overnight. They aren't homeless. They're actually just waiting in line to see the doctor the next day. But if you have enough money, you can actually buy a ticket to cut in line. So some hawkers, they resell the tickets that originally cost €2, and they can sell it to you for €100. So you don't have to wait in line like these people. And in China, there is a system of hospital classing. It's called the tiering system. So class 3 hospitals, these are the best hospitals in China, and they get all the best equipment, they get the best buildings, and they get the best doctors. Also, all people in China always want to go see a doctor in a class 3 hospital, even if it's just a cold. So they become overburdened, whereas the class 2 hospitals, they aren't as busy, and the class 1 hospitals are kind of like the regional clinics who aren't able to do much. So there was one class 2 hospital that I visited in the countryside in China, and they were trying to do what is called a PCI surgery. So it's a interventional cardio surgery. And to do this, you need what is called a C-arm, and it rotates around the person's body to scan it or x-ray it so that the doctor can see where it puts its catheter. So this hospital didn't have a C-arm, but they still wanted to do the surgery. So instead of buying a C-arm, which they couldn't afford, they actually turned the patient when they needed to see the different side. So not only are these resources complex, but the healthcare coverage itself is also a complex situation. Because China is socialist, it supposedly covers the healthcare of all of its people. So the government says that it covers 95% of the population. But what does that really mean? Actually, it depends on where you live and where you were born to see how much healthcare support you actually get. So some people might only get €40 of support a year. So onto relationships, which is a very important part of the healing process. And what's more important than the relationship between the patient and the doctor himself? And unfortunately, in China, there's been a huge breakdown of trust between the patients and the doctors. So this is a crime scene from where a patient actually killed a doctor. And this is not an isolated incident. Last year alone, there were 18,000 incidents of personal violence between patients and nurses and doctors. Even when the system is going well, this relationship between the doctor and the patient is actually very complicated. So a doctor must see 200 patients each day. And for all of their hard work, they only get paid about €400 a month. So they're very much in a very burdened situation. So as a patient, if you want to see a doctor, either you must have really good guanxi, which means that you must have a relationship built up over years of favors done for the doctors or the doctor's family, or you must pay a red envelope to the doctor in order to get the care that you need. And lastly, within relationships, the family relationship is very important, not just for Chinese, but for all countries. But in China, because of the one-child policy, there is this structure called 4-2-1, where 2 adults, working adults, need to take care of 4 seniors and 1 child. So this places a huge burden on these working adults. And because of this, everyone in China is afraid of getting very, very ill because they don't think they can handle the situation if such a thing happens. So there was this one patient that I met in Shenzhen who had developed a chronic illness. And she was living with her mother-in-law, who happened to be diabetic. And when she was diagnosed with this illness, the husband and the mother-in-law kicked her out of the house and divorced her because they couldn't afford to take care of one more sick person in the house. So the results of treatment or healthcare also varies widely in China. And one of the big problems here is chronic disease. So I'm sure this is the case in many countries, but in China, 80% of the healthcare spending goes to support chronic disease patients. And hence, a lot of the resources cannot go to healing people where they're needed. This is a couple I met. So this guy's legally blind, and his wife also has a chronic illness. And because he cannot take care of her in their home, so they basically just live in the hospital. And this is actually quite common amongst either people who have worked for the government or for people who have just retired from the army. So this takes up a lot of the resources over there. And lastly is the refusal to screen or to even treat themselves. So it's strange because a lot of Chinese people, they're afraid of getting diagnosed. Or even if they are diagnosed, they are afraid of getting the treatment they're needed, such as a small surgery or a certain type of medicine. And one of the reasons for this is because the earlier they start their treatment, the more it will cost them. But also, through the traditional Chinese medicine sense, some feel that like certain minimally invasive operations would harm their qi and reduce their healing power. So this is a problem because we all know that earlier screening can improve the results of treatment. But because Chinese people, they don't get treated until much later in their disease state, we have a large population of chronically diseased people who are in much serious condition than in the West. So it's very challenging for the doctors there. But with all these problems, there are also opportunities. And at IDEO, we often believe that by observing extreme situations, we can actually find inspiration for design. So, as we mentioned earlier today, we could also spend time talking about products and technology innovations. But actually, what I wanted to talk about are our systems-level solutions, because these are the solutions that can create the most impact in the shortest amount of time in the healthcare system. So here are 9 system-level opportunities for healthcare design. And while these are inspired by China, hopefully they can apply to your country as well. So this is a common theme for today, I guess. How do we do more with less? And especially in China, where resources are so limited. So one of the things that has happened is that hospitals, for example, class 2 hospitals who are not able to compete as well with the best hospitals in the country, they've decided to specialize. And for example, you have then hospitals that are special in liver surgery or heart surgery, and they then don't provide a full service to the patient. And also class 1 hospitals, they start to function as a first level of screening, and they direct the patients in the right direction into the right hospital care. But in order to provide a complete care to the patient, they create strategic alliances with all sorts of hospitals in order to create like a total package so that they know where to send the patient for a specific issue. The second idea is you don't need to have to see a doctor for everything. So how do we distribute the responsibilities to, for example, other types of professionals? So the Minute Clinic in the US is an example of this, where you can go and see the doctor for very simple ailments, such as colds or cuts, and you'll be seen by a nurse. So this is run mainly by nurses and a few physicians. Another startup called Care at Home, they manage a team of health coaches. These coaches, they're instructed with tablets, and these tablets have software that guide them on how to talk to patients. So for patients that have just left the hospital, most of them, the larger part of the pyramid, gets contacted by these coaches. And a smaller part who need further assistance, they're visited by nurses. And the smallest portion are people in very strict need who have to go to the hospital. So this helps balance out the resources of the system much more. So along this theme, not every problem needs to see a doctor for a whole consultation. So this one startup in China, it has actually connected all the best doctors in the country on this app. So as a patient, you can actually just go on this app and find a doctor you want to talk to. So for 20 euro cents, you can ask a doctor a question without having to go to the hospital. And for 2 euros, you can make a call to the doctor. So by splitting the doctor's time into much smaller pieces, you can actually reduce the cost of the system and also create a lot of convenience for the patient. So the added benefit of this is that people stuck in the rural countryside of China, they don't have to travel too far to see the best doctor from the best tier 1 city in China. So onto relationships, and I think providing relationships, the proper relationships, is about providing caring, not just care. And this is very important even in the doctor-patient relationship as well. So better relationships create better healing. And there are some startups in China who are also focused on creating a personal communications tool between the patient and the doctor. So this is one such tool. And when the patient goes home, the doctor can message the patient and see how he or she is doing. And the patient can pose questions to the doctor. The other important thing is, that is happening is around team medicine. And this is being enabled by technology startups like this one. So team medicine, there's this one team in China who's especially famous and an advocate of this. It's a heart specialist. And when their head doctor is not there, all the rest of the team members can access the patient files through a common app. So it's a patient file, digital patient file management that works through any type of tablet or phone. So any doctor within a team can pick up the care of that patient. And they can even share the documents or the files of the patient to other specialists to consult to see if they have any other kind of opinions. And within the healing journey, we can't underestimate the relationship between the patients and other patients. So there are many companies focused on things like this, but in China, it's very obvious that fellow patients, they can influence the choices of other patients just by being there to listen and to talk to them about their experiences. But not only this, it's also the families who can benefit a lot from talking to other families who are suffering with similar kind of family members' issues. So in China, there's like thousands of groups run on QQ, which is the ICQ or MSN version in China. And these are groups started by patients. And if you have a certain issue like diabetes, you can join and see what people are talking about. And they might even suggest good doctors to go to or alternative treatments. And so the last bit of opportunity areas is results. And a lot of talk recently in the recent years have been about prevention. So I want to talk a little bit about this. So data, like wearables, this has been a hot topic. And everyone has tried, well, a lot of people have tried to track their data. So there's like a huge amount of data out there, but nobody really knows what to do with it. Supposedly, it can help you make better health decisions or be a healthier person. But this seems like the link is a bit broken. So there's an opportunity to create a service that helps patients or people understand what to do with their data. So one example is of the Ochsner Medical Group in the US. And I read about how they, as a heart disease clinic, they managed to get all their heart disease patients to buy a wireless scale and connect it to their system. So these patients would weigh their weight every day, and this would all go through a centralized analysis point. If one patient suddenly gained in weight, it meant there was something wrong with their heart disease because there was some kind of fluid accumulation. And so this would notify the doctor, who could then adjust that person's medication or ask him to come in for a checkup. So one of the terminologies in China that's very popular these days is called sub-healthy. This might not be as common here, but in China, about 76% of white-collar workers are sub-healthy. And what does that mean? It means people who are feeling very much unwell. They might have pains in their body, or they might be feeling low energy, but they cannot be diagnosed by the system. So these people, they go to the hospital, and the doctor doesn't know what's wrong with them, and then they send them home, but they don't feel well. So there's actually an opportunity to treat people like this who are on their way to being unhealthy, but not yet at that point yet. So we need to treat these people before they clog up the system and become a burden to the healthcare system. So one of the ways to do this is through holistic medicine. So it's about treating the person as a whole, not just his symptoms. So one example of holistic medicine is traditional Chinese medicine, otherwise known as TCM. And TCM can help people either prevent severe illness in the future, or it can actually be very specifically help to slow down a chronic illness. So just a few examples. Through Chinese herbal medicine, you can slow down the hardening of your arteries. You can reverse insulin resistance to slow down diabetes. And you can reduce the time of recovery after a stroke from 3 months down to 3 weeks. So it sounds very useful, but in China, only about a quarter of doctor visits are to the Chinese doctor. So Chinese people, they're still quite resistant of the idea of TCM. But the Chinese government has realized how important it will be in the future, because Western medicine is something that just keeps getting more expensive and more expensive as R&D is poured into medical pharmaceuticals as well as equipment. So not only China, but a lot of countries have to consider how to fit holistic medicine into the system so that it can help prevent more disease and also heal diseases that are probably not healable by Western medicine. So these were the 9 opportunities for design that we talked about today. And you might think perhaps your healthcare system is not as severe as the Chinese healthcare system, but actually a lot of these healthcare issues are universal. And a lot of these systems are also in big trouble. For example, in the UK, where there is a huge budget deficit because of healthcare spending. Or the Netherlands, where you have to wait 3 months for some minor surgery. Or Germany, who has a huge aging population problem. So going forward, China has no chance but to find some way to change and to innovate if it wants to be able to not to suffer the burden of the care of its future. Excuse me. So right now, you might think that there are some ways where China is a bit behind the healthcare of some of the other countries in the world. But because its challenges are so extreme, I think it's wise for all of us to keep an eye onto China to see where the future of healthcare could go. Thank you.